She's the pushy broad from the Bronx, New York. Follow her voice, a straight dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and support from experts in addiction, recovery, and life. You know, the pushy broad spends so much time worrying and talking with experts and doing this show, talking about substance misuse and alcohol. And now we want to talk about something called a process addiction, which means an addiction that is not a mood-altering substance. So I decided to bring in an expert. This particular show is something that I am sure you know somebody who is suffering from this. And now that we're back in school, and now that people are doing all kinds of things and summer vacation is over, this is a topic that I really want you to pay attention to. Today, we're going to explore the complexities of sex addiction. We're going to shed light on its root causes and the prevalence that is in this digital age. So my guest today is Eric Webber. He is a certified addiction specialist. He is also a certified counselor of sex addiction. And he has been working as a clinician at Karen since 2007. He works with adult men and relapse patients in both primary and extended care. He served as a clinical supervisor for the men's primary unit and the director of men's relapse and extended care. He is a certified alcohol and drug counselor, a certified clinical supervisor, and holds a certificate of competency in problem gambling, and he's also on the Pennsylvania Certification Board. He's a certified sex addiction therapist and a certified multiple addiction therapist through the International Institute for Trauma and Addiction Professionals. The Pushy Broad from the Bronx and Recovery Recharged is honored to bring this expert today. Good morning, Eric Webber. How are you?
I am lovely. Thank you for having me, Ellen. Great to be here again.
Thank you so much for coming back and returning. You and I both know that September is National Recovery Month, and one of the things that people overlook are the process addictions of gambling and sex addiction. The last time you came on my show, we talked about gambling. Now I want to focus on a topic that people shy away from, but I'm Pushy Broad here. We go straight for it. So tell me, how do we define sex addiction, and what differentiates it from normal sexual behavior?
That's a great question. And it's interesting because I would say it's not super black and white. We can list some criteria, but I prefer to stay to actually a little more general. We talk about addiction. Is there obsession? Is there compulsion, powerlessness? And is it making your life unmanageable? Right. And so there's this gray area when we start talking about certain sexual behaviors and somebody says, well, that sounds like sex addiction. Somebody says, no, that's just my normal behavior. It doesn't cause me problems. And that's when somebody really has to, we encourage somebody to investigate, because it's not always black and white. Why is this a taboo subject? Because not everybody agrees what's right, wrong, acceptable, and unacceptable.
All right. So what do you begin to see as a potential problem? Just give me an example.
Sure. So a potential problem in my realm, because I'm an inpatient provider, is when somebody says, look, I'm doing drugs or drinking and I'm acting out sexually in ways that otherwise I wouldn't, or I have a lot of shame around. For instance, somebody says, look, when I start drinking and using cocaine, I start engaging with prostitutes, or I was really drunk and I went home with somebody, had a one-night stand, and I've never done that before. it's where we see behaviors that wouldn't normally pop up when there's a lot of times when there's chemicals or when there's other things going on. You see that sometimes in midlife crisis, somebody in emotional distress, post relationship ending, they're having professional problems. They might start acting out sexually to not feel what's going on professionally. Any of these things can sort of push somebody into that realm of doing something sexually that they're either very ashamed of or they wouldn't normally do in an otherwise, sane frame of mind.
As you say, you work for an inpatient treatment center, so people come to you already with a co-occurring situation. They are on a mood-altering substance, and now they are exhibiting other forms of addiction in terms of sexual promiscuity, or maybe spending a lot of time watching porn or sexting or social media. But we can find this as a separate entity, can we not? Someone doesn't necessarily have to be on a mood-altering substance to have a problem with sexual addiction. Is that right?
Absolutely. Absolutely. When we take a look at it, and I think a lot of sexual addiction therapy on an outpatient basis, the mood-altering chemical either is very minor or it's not there at all, or the problem is primary sexually acting out in some way, shape, or form. And in this day and age, technology has not done us any favors with folks who are prone to addictive processes like sex addiction, with the internet, with the phone, with the dating apps, with the pornography in, HD, 4K, whatever, the newest resolution is, versus 30, 40 years ago when you sort of had to go sneak over to your dad's Playboy collection and kind of sneak a peek, or the Victoria's Secret catalog came around. You got all excited because, page 7, you had this. You're laughing because you remember. I'm old enough to remember those days. And so having
so much for pointing that out, Eric.
my bad. So, I mean, it's the modern technology is something really to be mindful of. And to your point, it's because it taps into that part of our brain, and on a subject we don't talk about. This is taboo. People don't talk about sex. They're not honest about sex. We'll talk about everything else, most other things, but people are not honest about sex because it still has a moral weight to it, a moral shadow sometimes, a lot of shame. Oh my God, you did that. And that's, whether that's religious, ethnic, familial, cultural background, whatever, that weighs on a lot of people.
It absolutely does. And I can see what you're saying. And I want people out there to understand that there are ways to determine whether or not somebody has a sex addiction problem. And I think that has a lot to do with duration and frequency. Talk to us a little bit about that.
Sure. In any given behavior, duration, frequency, resources used, money, time, stepping over personal values or legal values. When these things start to progress, sex addiction will have a progression much like any other addiction. If I'm working with somebody, for instance, who has a pornography addiction, we'll start with, okay, what did you start with? Well, we started watching this and for this amount of time, and then it started to become more time, and then it became more frequently through the day. Then it was on my phone, at work, in the bathroom, or locked in my office, and I wasn't getting my work done. And and we see this again progression and the unmanageability because other areas of life start getting interrupted. And then somebody wants to stop and they can't stop, or they're struggling with stopping or cutting down. And so as we see that piece, it's very similar to other addictions as it grows and gets worse.
Do you find that the sex addiction piece itself is mostly a male-oriented disease?
I don't know, to be honest with you. I don't know that I have the right view, because I work mostly with men, some women, but mostly with men. I don't have a good perspective on that. I would say both men and women can have the propensity to struggle with addiction, and it may pop out sexually. Again, I would say what are society's views and the shame put on it? We know that men are more likely to come to treatment, inpatient treatment, than women are. You just take a look at the numbers. You take a look at some of the sociological studies and things people have talked about. Men are going to come to treatment more frequently and, quite frankly, more easily. But that doesn't mean there's not a lot of women struggling with various addictions as well.
So, as you said, in residential treatment, you have the opportunity to witness the substance addiction coupled with the sex addiction. Talk to us about the mental health disorder that is entwined in all of this. What kind of disorders are you seeing?
A lot of times, I would say, significant, majority of the time, you're going to find some sort of trauma. Typically a developmental trauma from earlier in life. That's a very, very common one. And whether that developmental trauma has to do with a particular event or series of events, or it's more developmental, like from a parental standpoint, we're going to see that a lot. So if somebody comes in and they have both chemicals and sex addiction, we're really going to probe deeply for trauma, whatever that looks like, and see whether that needs to be addressed immediately, concurrently, whether that's something we suggest to work on a little further down the road. And there's various trauma therapies that can be offered at this level of care and other level of cares as well. And very successfully, I would say. I think that's an important aspect. If somebody's saying, I want to go find treatment for this, be open to having that co-occurring trauma treatment that goes with it. I think that's probably the number one mental health thing we'll see in combination with the sex addiction. Sometimes there's some anxiousness, anxiety, anxious attachment, sometimes some depression, but quite frankly, if somebody has depression, a lot of times their libido decreases, so their sexual activity will decrease. So we don't necessarily see that a lot. It's more about the trauma and the trauma reaction.
So if I am a parent and I have an adolescent or I have a young adult that is living at home and I begin to be concerned, what should I be looking out for?
I think the obvious ones are screen time and what they're looking at. As a parent, I think it's responsible parenting to know what your children are being exposed to, at least to the best of your ability. You can't necessarily know everything. And I think being mindful, depending how old somebody's children are, being mindful of, are they going to get screen time at 2, 3, 4 years old? Or do we, as a parent, do you hold that back? I don't have the answer for that. I was just watching a news special on that, and people were discussing, how old is appropriate for it to start screen time and what amount of screen time moving forward. I think that's probably the place to start if somebody's wondering whether their child is struggling with the beginnings or getting into sex addiction. Does the child have, what kind of social life do they have? What kind of friends are they bringing around, or friends that they're going to? And this stuff my parents would have wondered back in the day as well, but now the influence of the technology, again, overlapping that. What's the transparency of the teenager and their phone? Are they willing to show mom and dad some of the conversations if there is concern?
And also finding out exactly what they know and what they don't know, meaning when you decide as responsible parents to begin the sex conversation, wouldn't you say there has to be some openness in the discussions and make it easy and acceptable for children to begin to talk to you? Is that right?
I would agree with that. I remember when I was a kid having the ability to have a question. Hey, mom, dad, what's this? All right. And the agreement was I could ask anything, that I had a curiosity about. They would give me hopefully an age appropriate answer. I think that, what we used to call it the birds and the bees talk. I think that age in society today is probably getting younger because the exposure of sexually charged materials just gets more and more. And I'm not saying whether that's right or wrong. I think it's just a fact. If you just take a look at the way we dress today, casually, we had a conversation the other day, whether midriffs are appropriate to be worn in treatment. Could that be stimulating for somebody who does have a sex addiction sex addiction, even proclivity. And one of my counterparts says, well, is a midriff inherently sexy? Is it inherently sexual? Well, you're exposing a part of your body that typically somebody's going to say, yes, that's attractive. So we want to be mindful of that. Go to the gym. I mean, look, yoga pants are today's fashion. I'm one of the few people walking around in a suit these days. Yoga pants are a revealing piece of clothing. Go to the grocery store. You're going to see a lot of folks in yoga pants. How does that affect somebody's sexual template, what they're thinking about, their arousal template, what they're thinking about, and being mindful of that. And as teenagers or even preteens, they're being exposed to that because they're walking through the store as well. So that's a long, rambling answer to the age is probably getting lower and lower and lower.
I understand, and certainly a real concern for parents. Again, especially since the school year is starting, but we had, summer vacation, and people in this summer, especially in this heat, are scantily clad, and it always raises questions as to what's enticing and what people have to watch out for. So, is there any misconceptions we have about sex addiction that maybe the public needs to understand better?
I would say there's a whole lot. What are the most important ones? Dealing with shame around sexual behavior, like being open to being able to talk about it, is really, really important when we talk about sex addiction and sex addiction treatment. Sex addiction isn't necessarily just running out and trying to have sex with everybody I possibly can. It can very much be focused on one person or one thing. And I find it just completely obsessive, compulsive, and taking over. Imagine puppy love gone completely awry. You meet somebody for the first time, you're kind of like, ooh, I'm going to text him the whole time and day, and that progresses, or that matures. Where sex addiction, that doesn't mature, it keeps on going, maybe gets more obsessive. And I think understanding that can be sex addiction. Pornography. Sex addiction can be any variety of behaviors that are unhealthy for somebody who says, I'm an exhibitionist. I really want to get caught having sex. That's what makes it really, really exciting. And I can't be sexual without that danger. And that danger may get me arrested. That's something, I think people don't necessarily think of in the sex addiction realm, but that's a part of it. So it can be a part of it. So understanding that these behaviors, there's a wide variety of behaviors, not just, oh, gee, they're chasing down sex all the time. It's a much broader issue to be discussed for people.
Right. It's much, much stronger than a large sexual appetite. It always goes to frequency and duration. And also, if you feel that the person that you're with is a little over the top because they're doing something that doesn't seem natural to you and it seems over the top, I want you to take a good look at it. And if you're finding that these situations are happening to you, understand that there is a way to get help over it. So talk to us a little bit about the whole idea of the stigma of shame and guilt and what it's like when people come to you. How does your therapy treat this particular situation?
As a therapist, I think the first thing to do is normalize what's going on. If I'm sitting with a young man and he's struggling with pornography addiction, the first thing I want to do is normalize pornography addiction. Like, look, let's take a look at the hard numbers of who's watching pornography. You can find these out. The data's there. You are not the only person who's sitting there watching these videos. In fact, I can tell you 1,000 or 100,000 or 1.3 million people have seen this because the sites keep those statistics. And you're not alone. You're not alone. Other people struggle with this. It's not unlike alcohol or drugs or anything else. Let's normalize it a little bit of you're not the only one struggling. And what is healthy sexual behavior? I think that's the other piece. And makes treating sex addiction a little bit different than, say, drugs and alcohol. We're going to say complete abstinence, don't do it. Sex addiction, okay, a behavior may not be healthy, but we want you to have a sexual healthy life and define that and work towards that. So it's about your relationship with sex that really needs to be examined, addressed, and articulated in that fashion, I believe.
So people shouldn't be worried that you're going to say to them, no sex for you ever, correct?
I have never sent anybody to the monastery or, now there's some things we can do. So for instance, if somebody's struggling with pornography addiction, we'll say, okay, we want abstinence from pornography, at least for X period of time. And if at what point you want to re-engage in something, that is a discussion with therapist and sponsor and whoever else to see what is healthy. A lot of times I go back to the big book of Alcoholics Anonymous and say, you looked for the healthy sexual ideal and work towards it. I love the way that's phrased, right? And I tend to, when I'm working with somebody, say, what's healthy for you? Let's talk about that. And I try and be funny with it. I say, look, you want to dress up like Batman and swing from the chandelier? I got no problems with that as long as your partner's cool with it. The chandelier is firmly in the ceiling so it doesn't come crashing down. And you don't feel shame at the end of the night. You feel kind of like, hey, we had a good time. I don't care. If any of those other things aren't there, we need to talk about this. So it's not even so much about the behavior a lot of times. It's about, to your point, frequency, duration, negative impact on life, and how do we want to define this as healthy?
Speaking about partners, let's talk about family and couples. How do you get those people involved?
I think it depends on level of care. For me, inpatient level of care, I'm working directly with the patient. We do involve the family members. When appropriate, we will do family sessions directly around the sexual addiction, whatever those sexual behaviors are. We might do a disclosure session where somebody says, look, I haven't been honest with my significant other. I need to get honest. And we do a very structured disclosure session, which can be very helpful, but also very, very tense and stressful. So we want to make sure it's done carefully and safely. Sometimes it's simply defining what, as a couple, they want their sexual life to be. And that can vary from couple to couple. I've had a number of couples I've worked with in the past that have open relationships. Like, okay, let's define what an open relationship is. Where are the boundaries? How firm are those boundaries? Where's the negotiation room? And most of the couples I work with have a closed relationship, but that's something different when I have a couple that says, hey, we have an open relationship. Okay, let's define this and figure out what healthy is. And it's just got to be an open conversation that people feel relatively comfortable having. And if not, then to try and get them to be comfortable, at least articulating.
Well, that's why having a therapist as a moderator and a mediator and a therapeutic liaison is something that couples should really seek out when it comes to this situation, because it becomes difficult, it becomes accusatory, sometimes critical. So in order for you to do the right thing, make sure that you are working with a professional. Okay, so in today's landscape, what would happen if the sexual addiction went untreated? What are some of the potential dangers?
Depending what the addiction is and how the unmanageability manifests. Look, is it illegal? Somebody can get arrested. A lot of times sexual addiction can lead to acts, just like drug addiction, can lead to acts outside the realm of legal society. It can lead to untreated. It can lead to crushed families, destroyed family systems, where somebody says, look, I'm not putting up with this anymore. Or the children or the parents say, look, we're not putting up with this anymore. Depending on the impact on time resources, if I'm spending that much time online and I can't get offline, am I late from work, not get my work done, decrease performance at work, and eventually I get fired because I can't get off the screen. I'm just using that as an example. Or I go on a 3-day bender and I don't show up, right? I'm just doing what I'm doing. And I just don't show up for life. And then I start to have consequences, financial consequences, depending on the nature of the addiction. Pornography, you start going to pay sites, using, sex workers, money. And so, there's a possibility of a financial crisis with that as well. So various areas of life can be impacted the further the addiction moves forward.
Eric, thanks so much. We have about 30 seconds. I want you to talk to us a little bit about how you see the future. Are you optimistic? Talk to us about some of the success stories and tell us where to find you.
I am optimistic. I think more and more people are getting more and more comfortable, just like with alcohol, drugs, people are getting more and more comfortable talking about this. And as we hear people in the media, people who are well-known, famous, decide to come out and say, hey, look, I had a problem and I got help. This is where I got help. I think that helps reduce the stigma when society can see somebody that they look up to say, I asked for help, I got it, now I'm better.
Eric Webber, certified addiction specialist, certified sex addiction therapist. Thank you so much for joining me today. If you want more information, go to Caron, CARON.org. This is the Pushy Broad from the Bronx saying thank you so much. We'll see you next time. This is Ellen Stewart, the Pushy Broad from the Bronx, saying thanks for listening. And remember, everybody needs a little push.
From the Pushy Broad from the Bronx, New York.